he's there. He
That's
was
what I
in
got.
for
That's where I'm at.
surgery on Monday.
Committee meeting. If we could all stand for the Pledge of Allegiance, please. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
If the clerk could take the roll, please.
Commissioner Angie,
Present.
Commissioner Torello,
Present.
Commissioner Samasco, Commissioner Zeller,
Present.
Commissioner Rushing,
Here.
Commissioner Vanden Bosch.
Here.
Commissioner Beaton.
Present. Are there any changes, deletions, or additions to the agenda?
Make
Hearing
motion to accept the agenda as presented.
support. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. We do have several people wishing to be heard this evening, so I'll call the first person's name and then I'll let you know who's up next so that you can get ready. So the first person this evening is Mary Conlin with Kathy Bladeau second.
Good evening. I'd like to open in prayer.
Thanks.
Father God, we just humble ourselves and come before you, and we ask for your presence in this place. Just like the Our Father, we say, your kingdom come, your will be done here on earth as it is in heaven. Father, I ask that you give these commissioners wisdom and understanding on how to operate our county. And I ask your blessing on everyone who is here in Jesus' name, amen.
Amen. Kathy Bladeau, followed by Dawn Falk.
Hi, trying to make it French. It's Kathy Bladeau.
Oh,
Bladeau.
sorry.
Hi, my name is Kathy Bladeau. Thank you for allowing me to speak my opinions here tonight, Board of Commissioners. I was a 20-year nursing supervisor, St. Clair County Health Department. I retired in 21. I supervised the Teen Health Center, the Family Planning Clinic, and the STD HIV Clinic for 12 years, and WIC for 8 years. And it was the most rewarding time of my life. That being said, I'm here with concerns about the medical director employment agreement that has been changed with verbiage added and verbiage deleted. So tonight, I can't say it all because I only have 3 minutes, but I would say that I'm most concerned about the contract may be terminated without cause by the Board of Commissioners, only by a unanimous vote. So I'd like to say that inserting a unanimous voting requirement to fire a medical director or public health officer is generally considered unwise in governance. It grants a single dissenting vote the power to block termination, which can lead to administrative gridlock, diminish board accountability, and make it nearly impossible to remove a director for poor performance. I would not recommend that for anybody, for any position, the health officer, the medical director, anyone. And the reasons why, if even one commissioner is loyal to the director, biased, or holds a political grudge, the director becomes untouchable, no matter how egregious their negligence or misconduct. Unanimous standard invites severe political leverage and makes standard oversight extremely difficult. And elected commissioners are responsible to their constituents. That's us. Binding their hands prevents them from acting on the community's behalf when a change in public health leadership is necessary. So, and also, the other thing I'm most concerned about is the need for a medical deputy. And the reason I'm concerned about that is I worked under 3 medical directors, didn't have any deputies, 3 medical directors and in my tenure there. And there was never a need for that. We had the nurse director, the nursing director. Now you have an assistant nursing director. We had the supervisors of all the programs. We had the program coordinators. We had the nurse practitioners. And we had other medical directors when they were absent that we could call at a moment's notice. And I would recommend that you not put that in there. There's no need for it. And I would recommend to Dr. Nevin that he call or he look upon his peers and his colleagues in MELF to see if there's someone there that could cover him. There's no need to do that. There's other things, but I thank you because my time's up. All right.
Dawn Falk. Dawn Falk, followed by Dorothy Yo.
Good evening, Dawn Falk, Port Huron Township. I'm here speaking tonight in strong support of the proposed revisions to the contract of Dr. Nevin as medical director of St. Clair County Health Department. Dr. Nevin's contract with St. Clair County Health Department recently auto-renewed on June 23rd, 2026. So we're talking about revisions tonight. The revisions strengthen accountability, clarify responsibility, and reinforce the importance of professional medical oversight within our public health system. One important change that I especially appreciate is the provision requiring appropriate medical coverage during the medical director's absence, hopefully through the newly proposed deputy medical director. Public health is too important to leave gaps in medical oversight, and this revision helps ensure continuity of leadership and medical guidance for both staff and the community. I also strongly support the language reaffirming the health officer carries out public health policy and programs under the direction of the medical director on matters involving public health policy and medical programs. That distinction matters. The medical director is the physician responsible for providing medical expertise and professional judgment. Administrative authority should not override sound medical guidance. I particularly appreciate the provision stating that when the professional or physiological degree agreements or disagreements arise, that the health officer and the medical director, the health officer shall defer to the medical director's professional medical judgment or seek review for from the county administrator. That is a fair, professional, and responsible process. Checks and balances, if you will. These revisions help ensure that decisions affecting public health remain grounded in qualified medical expertise, clear accountability, and professional integrity. And I respectfully urge the board to support these revisions. Thank you and have a happy 4th of July. Thanks.
Dorothy Yoke, followed by Melissa Merchant. Dorothy Yope and then Melissa Merchant, or we can switch it since you're there. We'll switch it. We'll switch.
Good evening. My name is Melissa Merchant. I'm a lifelong resident of St. Clair County. If I'm up here, things must be really bad because I not like public speaking. I am really furious with the way St. Clair County is going as far as the health department. We do not need an RFP junior in St. Clair County.
Please keep it down. We need to get through all of the public comment. We want everyone to be respectful during public comment, please.
I believe the majority of people do not want the changes in St. Clair County. We would like to stick with sound medical science and not conspiracy theories. It seems to me that the majority of people who show up to these don't want Dr. Nevin here. And it seems to me the county, he's trying to subvert the will of the people. Kids need access to those health clinics. Just because one parent saw something at the health clinic they didn't like, I'm tired of people forcing their religion on our public health care. I'm just tired of it. I'm tired of religion being forced down our throats. Stay out of the exam rooms. Just stay out. I'm tired of the right trying to tell us what we can and cannot do and what we should and shouldn't do. Just stop already and go back to common sense and science. Thank you.
So Dorothy Yope. So we have Dorothy Yope followed by Jamie Sternberg. Thank you.
Hi, I'm Dorothy Yope, and I am running for County Commissioner District 5. I just wanted to address the commissioners tonight and comment on what I did last time, that I have been going door to door to door and talking to lots of citizens. I have sweat to prove it today. And my standard operation is to ask, what are your concerns? What do you think someone running for county commissioner should know? And again, and again, and again, the health department comes up in this extreme and radical agenda. It is not what most of St. Clair County wants, regardless if they're Republican, Independent, Democrat. I'm hearing it over and over again. So just for a minute, let me be your campaign managers. I assure you that when it's your turn to run for office, there will be an organized and highly motivated campaign for any commissioner that votes for this contract tonight. I assure you. St. Clair County does not want an STD outbreak. They do not want limited access to care. They do not want a measles outbreak or rotten teeth. Do us a favor and tonight vote to terminate Dr. Nevin's contract. Thank you.
Jamie Sternberg. Jamie Sternberg, followed by Angie Dufresne.
Thank you for allowing me to speak, Commissioners. My name is Jamie Sternberg. I live in District 7. I've been out here 33 years. I'm also a certified nurse midwife and board certified women's health practitioner. And the reason I'm here tonight is because I am really concerned about Dr. Nevin's proposals to cut Title X funding for reproductive health, his recommendation that we remove fluoride from our water, which protects dental health. And if you've worked in my field, I started out as a cardiovascular nurse. You know that rotten teeth also lead to heart attacks, strokes, cardiovascular disease, kidney failure, urinary tract infections, kidney infections. So not providing fluoride in our water, making sure we have proper dental health is detrimental to the citizens of this county, okay, to start with. Women are the most underserved population in America, and that is especially true in St. Clair County. Our healthcare system here in the county is so bad that there are federal grants to open clinics. Nobody wants to come out and do it. And part of the reason they don't want to come out and do it is because we have a director who spends more time worrying about DEI and inclusion in hiring and talking to students at the healthcare centers, who's more worried about Google toilet research and making people happy with those kind of weird conspiracy theories than he is about following science, proven science, decades of science. To cut our young people off from reproductive health would cause STD outbreaks, pregnancies, unwanted pregnancies. It would saddle young people with children they can't afford and can't properly raise before they can get themselves an education and good jobs. We can prevent all of that. But to turn that over to an FQHC system that in this county is woefully inadequate, that fails to provide dental services, fails to provide proper mental health services, does not have enough doctors to take on almost 100,000 people in this county, would be at best irresponsible, but most likely it would be deleterious to our population. And it would, the overall health of this county would decline, and it's dangerous. You know, I know Dr. Nevin, I read his papers when I went to Georgetown University. He did some great work on the bad effects of hydroxychloroquine in treating malaria. He'd be great as an infectious disease consultant, but as a medical director, he does not have the public health experience, knowledge, or respect for scientific consensus that this county needs to keep our population healthy, productive, and working. Thank you for your time.
Angie Dufresne, followed by David Huffman.
Hello, Angie Dufresne from Fort Gratiot. I'm one of the original residents of Fort Gratiot that came to this board asking for help with the solar development. Dr. Nevin has been really helpful to everybody. There was just a court hearing for the Clyde lawsuit on Monday, and Dr. Nevin was in the crowd. And he was there to talk to the residents afterwards and answer any questions that he could. I'm here tonight because of the misinformation that is being shared all over social media about Dr. Nevin. I've heard people say that he doesn't care about anybody. Well, I disagree. I watched him come out and walk around that project outline. I watched him spend hours talking on the phone with the people that were impacted by this project. I'm sick of coming to meetings and dealing with the constant, name calling, calling for him to resign. I really wish that, they would just stop. I'm glad to hear that his contract's already been renewed, but I would like to see some of those revisions put in place. I don't think it's uncalled for to want a unanimous vote to fire somebody who has an employment contract, when there's this kind of smear campaign going on. This has been going on for months. I give him kudos for dealing with it over and over and over again, listening without striking back. And he doesn't even usually stand up for himself. So I'm here tonight to support what Dr. Nevin is doing. If he would like a deputy director to help him fulfill his duties, I think it's important that he have that, especially with the limited hours he receives. So thank you.
David Huffman. David Huffman, followed by Mary Lou Kramer. Is David Huffman?
Thank you, Commissioners, for allowing me to speak tonight. I'd like to open with a short prayer as well. Father God, we come before you as people who have differences. We trust in you to be vigilant in the way of truth in the hearts and minds of these, our community servants. Give them wisdom and understanding. In Jesus' name we pray. Amen. I'd like to thank the Commissioners for their unwavering trajectory in pursuing common sense and logic as they make decisions that are in the best interest of our community. There has been and is much division between the Health Department administrative head and the true professionalism of Dr. Nevin. The policy changes that are being suggested should ensure that the licensing of Dr. Nevin's credentials do not come into jeopardy on the basis of administrative decisions. This is only appropriate. And one way to ensure this is to legislate Dr. Nevin as the final decision maker for all things health related. There really is no shared responsibility at the present time between these two positions of the medical director and the administrative representative for the health department, and as only one of the two is a duly qualified doctor. It's certainly a shame when individuals resort to baseless allegations against the good doctor's name simply to smear him. One of the things that I can tell you is that when you have something like this on your leg, I got it because a doctor gave it to me, not because a nurse gave it to me. So the doctor's good reputation has been smeared, and I, for one, suggest that those smears stop because they're baseless allegations. Thank you for your time.
Mary Lou Kramer, followed by Judy Wilton.
Good evening. Thank you for letting me speak this evening. I do not support these changes to this contract. I looked at Mr. Hall and I said, where do you go to get an auto renew contract? And he said, St. Clair County. I said, I guess so. I had two parents who between the two of them had 80 plus years of teaching experience and never had an auto renew contract. What everybody fails to realize is that whether you're the medical director of the health department or you're a physician on staff at Port Huron Hospital or Lake Huron Hospital, the person at the top of the pile is not an MD usually. So there are plenty of lay people who tell those doctors what to do and that. And yes, have a say in their performance. Now, I understand that Dr. Nevin didn't have a review for this contract, which I think is absurd. And I started doing the math and I figured that considering the time that you folks have been on this county board, I probably have more experience with the health department, with the exception of some of the very long-term direct employees, because I worked with that health department for 35 years during my career, okay? I was in and out of there all the time. And never have we ever had a deputy medical director. Always the part-time medical director and the health officer. The health officer is the administrator of that department. Therefore, that person is above the doctor. The doctor is there to see patients, not run the department. He doesn't handle the finances. He doesn't handle any of that stuff. So you need to keep the order correctly. And that is the same in every health department in the state of Michigan, okay? That's the way it goes, you know? And we have counties in this state that there's 4 in the Upper Peninsula that they share one medical director between 4 counties. Why? Because the population's so low. They don't have an assistant deputy director, okay? There's only one county, one area in the entire state that has it. And we don't need to be the second one to have a deputy medical director. If Dr. Nevin would stick to his job and do what he's supposed to do, but quite frankly, we don't need Dr. Nevin in St. Clair County, and we don't need his quackery medicine because he doesn't follow science. So I would be happy if we never gave that man a contract again. Thank you.
Judy Wilton, followed by Mike Wilton. Judy Wilton, followed by Mike Wilton.
Thank you for letting me speak tonight. Dr. Nevin is a very strong supporter of parental choice and environmental health and safety for our citizens, and we're fortunate to have him as our medical director. I appreciate the fact that he has made it easier for parents to opt out of vaccines. No more being put through the ringer if you don't want to vaccinate your child. We all saw what happened with the COVID shots, right? Why would you, would you still get the shots knowing what we know now? It's called parental choice.
Please, can we have decorum? She has 3 minutes to speak. Let's listen, please.
It's called parental choice to vaccinate your children. If you want to get your children vaccinated, that's fine, but it's parental choice. I like that he is listening and he's questioning the fluoridation of our drinking water. From what I've read, it caused lower IQs. Asia doesn't add fluoride to their drinking water, but they do add it to their salt and their milk. Their IQ's average was 104 to 107, while the US average is between 97 and 101. I'm not saying it's because of the fluoride, but at least question it. Give him the chance to question it. We could add it to our milk and our salt and let the parents decide whether or not they want to give it to their children. It's fine that it's in your toothpaste, but why should we be drinking it? It's just not good to be drinking fluoride. It's called parental choice. I liked his requirements on the industrial solar project that was planned in our county for over the 900 acres of precious farmland. He has put in place safeguards protecting our citizens from decommissioning costs, decibels that were too high, and unsightly views for the residents surrounding these sites. His work was impeccable and highly supported by many in our county and surrounding communities. It's called environmental health and safety. Overall, Dr. Nevin has been an asset to our community, and I am so thankful he chose St. Clair County. Thank you, Dr. Nevin.
Mike Wilton, followed by Patty Samar.
Ditto to everything she just said. That said, I have not seen one recommendation put forth by Dr. Nevin that wasn't based on sound scientific facts and the law. Not one. Not one. So I don't know where these people get this thing that he has some quack medicine. I just looked a little bit at his bio. I have to put these readers on it. Dr. Remington Nevin is a physician epidemiologist, an expert consultant, board certified in public health and general preventative medicine and in occupational medicine by the American Board of Preventive Medicine and certified in public health by the National Board of Public Health Examiners. You don't get those credentials overnight. It takes about 12 years. Not only that, he was an Army doctor, Army physician, a major in the Army. They trusted him to make decisions for large amounts of people. He has spoken before on, he has researched quinoline, which is anti-malarial drug. And he has done mass research on this, spoken before the US Senate, the Australian Senate, the UK Parliament, the Canadian Parliament. He's provided the Irish Department of Defense on quinine, lasting neurologic and psychiatric adverse effects. You know, his whole life has been devoted to public health and helping people. I mean, that's most of his life right there. You don't become major in the Army overnight either. You know, you got to have at least 4 or 5 years before you get to that level. And he was in medicine all that time, helping people. He saved lives. He saved lives. Now, not one recommendation that he has made before the county has been against the law or not based on science. And it's a godsend that he's here. That with this guy's credentials, he could go anywhere. Anywhere. It dumbfounds me that people would think he has some hidden conspiracy. If he was going to do that, he'd be out making millions right now.
If you could address the board, not the public, if you would.
If he could, he'd be out making millions right now. That said, I wasn't planning on speaking about the other comments that were brought up about fluoride, but go home tonight, read your toothpaste. It says, do not ingest. That little bit that you put in your mouth, it says, do not ingest for good reason. All that goes through your organs. I'm not a doctor, but
Okay.
it filters through your organs.
Your time's up.
Okay.
Thank you.
Patty Samar, followed by Dale Hemela.
I am the editor and publisher of Blue Water Woman magazine, and unlike the current county medical director, I care deeply about the women in our community. And tonight you will discuss renegotiating the medical director's contract into something that is so ironclad, nothing short of his death can release St. Clair County from the public health disaster that is Remy Nevin, but could be Nemi Revin too. In fact, based on his performance as reviewed by the Human Resources Department of the county, you should be working on firing him. Since Remy arrived at the health department, numerous employees have complained either directly to the Human Resources Department or to an employee hotline. The hotline committee consists of the St. Clair County clerk, the county prosecutor, and the county administrator, 3 very highly thought of administrators in our county. In their report to all of you, your weaselly little board of commissioners, you have refused to address this issue. The hotline committee stated the following to you in their report. We urge the board of commissioners to conduct a thorough investigation. You've done no such thing. Remy is a dangerous nuisance to public health, most especially women's health. He's a misogynist of the highest level, working in a department that employs primarily women and cares primarily for women. You're basically rewriting his contract because the weak little man does not like working for a woman. Give me a break. All medical doctors take the Hippocratic Oath. It includes the following statement: do no harm. Do no harm. Recommending that citizens avoid vaccinations, that municipalities decline the use of fluoride, declining state dollars that funded needed teen health centers, and then begging. He had to beg the Advisory Board of Health to give him their blessing, which they did not, which he claims that he did not need, to decline Title X dollars. That is doing harm. That is doing harm. I will end with a quote directly from the conclusion of the report from the St. Clair County Human Resources Department. After speaking at length with staff, the constant bombardment of demeaning and condescending behavior, the arrogant presentation of himself to colleagues from the state and county government, the disregard for the safety of patients and staff, the disdain and prejudice toward the community he was hired to serve is untenable long-term. State and local community partners are questioning our choice of a medical director, and as a result, various partners have discontinued providing or working with the St. Clair County Health Department. End quote. Stop negotiating a new contract and fire him now.
Dale Hemela. Dale Hemela, followed by Tim Evans.
Dale Hemela, Port Huron resident. Thank you for your the opportunity to address you tonight. I'd like to address one proposed employment agreement, one specific part of that. The proposed employment contract that requires unanimous approval of the board to terminate and dismiss anyone seems foolish, and certainly an unwise deal with someone who has created the controversy that Dr. Nevin has. Let me give you a sports analogy. A contract requiring full approval of the board to dismiss someone is like a sports team offering a no trade, no cut contract to a player. In the NBA, there's only 2 such contracts. Hello, LeBron. In the NFL, there's 8 deals like that. In Major League Baseball, out of 1,200 players, there's only 35 that have contracts of that nature. In the NHL, well, I mean, that's a little different, but still, only 15% of the players have those types of contracts. These teams are owned by some of the wealthiest people in the United States. They're managed by some of the smartest people in sports management in the country. And they know that these types of contracts are bad business. Would the Detroit Lions do this? Would the Pistons, the Tigers, the Red Wings? As poorly as these franchises have been managed from time to time, it's highly doubtful unless it was an exceptional superstar player. Based upon the evidence so far, I would not classify Dr. Evan as a superstar. It seems to me that bad business in all of these American pastimes would be bad business in local government, not only affecting you as a board, but tying the hands of a future board as well. My suggestion is to not do something so foolish. Thank you.
Tim Evans. Tim Evans. Tim Evans, followed by Dr. Renee Smith. Is Tim here? Oh, there he goes. Thank you.
Good evening. My name is Tim Evans, and I'm a longtime St. Clair resident. And quite honestly, I'd rather not be standing here tonight. I don't like speaking in public, and there are places I'd rather be tonight. But I'm here because I believe it's my civic duty to speak out about what I believe would be a serious mistake in approving the draft contract for Dr. Nevin. I don't believe Dr. Nevin's contract should be renewed at all. I believe his primary accomplishment up to this point is pasting a thin veneer of science speak onto what are fundamentally political actions. His full legacy will not be obvious for another decade, but it will undoubtedly include an increase in teen pregnancy and poorer dental health for the residents of our county. I can only pray that it will not also include the death of infants who were too young for measles vaccines if and when we lose herd immunity due to reduced measles vaccination rates. But I don't have any hope that I can convince you to terminate Dr. Nevin's contract. But I have at least a little hope that I can convince you to not lock in the county into a 3-year contract that will be nearly impossible to cancel. Purely from a personnel management perspective, I'm at a loss to see the justification for a clause requiring unanimous approval for termination. I believe such a clause would be highly unusual in private business. It would be similar to a board of directors signing a contract that effectively prevents the board from replacing a CEO, even if that CEO took the company in a direction they didn't approve of. So I ask you, why would you consider this? In the CEO example, I can at least imagine a case where such guarantee would be the only way to hire a hotshot CEO. But is that really the case here? Is it really the belief of the Board of Commissioners that Dr. Nevin would not renew his contract without this clause? Is a paycheck of nearly $200,000 per year for a part-time job not enough to entice Dr. Nevin? A rate of $1,000 per day is not enough? Do any of you believe that Dr. Nevin is not sufficiently motivated by that pay and by the opportunity to push his agenda? I urge you not to approve the contract as written, which would effectively tie not only your own hands, but the hands of future commissioners. Thank you.
Dr. Renee Smith, followed by Debbie Roberts.
Good evening. Firstly, I'd like to thank the commissioners for the opportunity again to address them. This is my 4th time here. I was surprised to hear that his contract has already been approved and that we're talking about modification. Certainly it didn't come across publicly. I am been a physician in this town for 30 years.
Can you talk a little closer to the mic,
Yeah,
please?
I've been a physician in this town for 30 years. I've been a licensed physician to practice medicine for 55. There are so many things that trouble me about Dr. Nevin's appointment. His lack of civility to all of his colleagues, the fact that he carries a gun to public meetings. In all my time, I don't ever remember knowing of a physician who specifically carried a weapon. It just doesn't happen for the most part. The fluoride issue, I realize is debatable, but I think it's mostly an issue, not so much of where it should be done, but a matter of how much fluoride. The other issues, when he first came to town, for a while, he was living in Illinois on account of his family. This was direct information I got from him when I first met him in the early days. There are so many red flags that I guess the long and the short is that I believe that Dr. Nevin should not be reappointed, period. I think there's just too many red flags. The other thing is that people who have spoken appropriately, that you can't, I believe it is a civic responsibility to decide that children can get vaccination, because one of the rights of the children, which I think has been mentioned before. In short, I believe personally, I've seen multiple deaths from the most simple things for not having had a vaccination. And I believe that by going with Dr. Nevin's policies, that literally children will both die and will be much more often will be severely damaged for lack of vaccines, which have been proven safe for so long that it's almost ludicrous to even contest his position. Thank you.
Deb Roberts. Deb Roberts, followed by Tracy Burgee.
Hello, I'm Deb Roberts, a lifetime
citizen of St. Clair County. I've been an RN for 28 years, worked at McLaren, and I taught at St. Clair County Community College Nursing Clinicals. I'm retired now, but I am the president of the Blue Water Immunization Partnership. And our goal is to increase immunity in our community in a respectful, educational way. And Dr. Nevin used to be part of our group, and then he just sort of faded away, but that's okay. I'm questioning, why does he want to get rid of Title X services? I mean, women are important. It's not just about contraception, and I do understand why parents of teenagers wouldn't want a nurse at a clinic giving contraception without the parents knowing. And I don't think that even happens. And Dr. Nevin can write, with his license, he can write a physician's order, and the nurses will follow that. They don't do anything against doctors' orders. So it's just such a moot point. It's just ridiculous to me. We need to provide these services. Women shouldn't be dying of cervical and breast cancer. We can provide these screenings. They also screen men for sexually transmitted infections. So those are public diseases that we need to take care of. Also, why hasn't Dr. Nevin been talking to the public? You know, he's like the little man, like the Wizard of Oz that's behind the curtain. And he sends out these memos and he's all, you know, doom and gloom. And he's just not a people person. He doesn't know how to lead. He's not effective. He's just turns people off. And yes, he cared about the solar panels, but you know why? It's because that's a big political thing. It was a political stunt. The same as with going around, like today's the day we're going around the county and we are going to erase all this 6-foot distance signs. I thought, what are we in second grade? You know, that was just such a big, like an attention seeking gimmick. I don't know, I disrespect him so much. I went down a rabbit hole. I did a big research project on fluoride and I studied his memo and all of his references. They are from other countries. They are not from the United States of America. And the the results they're going to get in China are different because they have a lot of, the earth has fluoride in it, so it gets in your drinking water. Also, there are contaminants in the air from factories. So his research, I took it to my friends that are doctors, and it's like, yeah, it's not really valid. He's just trying to push a point, and we can all kind of spoof it. You remember our papers, we did research papers in high school, and sometimes, you put a reference there because the teacher wanted 10 and maybe one was a little shady, but, that's what I think he did on his.
You need to wrap it up. 3 minutes up.
Okay, all righty, thank you. I just don't renew the contract.
Tracy Burgee, followed by Sandra Richardson.
Hello, I'm here in support of the Board of Commissioners. The job that you have in front of you is very difficult. I see that not everyone is going to be happy with whatever choice you make. But when I think of this digital that I happened to come across on Facebook, and it said that the health department is in crisis. No, I don't think that that's truly true. I would say it's just broken. And now when we see things that are broken, we need to find ways that we can put these things together that can represent the people of St. Clair County. We need to understand what the problem is here. I believe that we do not need more government in our families. For me, I need less government. I am okay with taking care of my family and deciding what works for me. I do not need my government telling me how I should raise my children since they're not there on a day-to-day basis. And I also think that when I look at where we are today, we should remember that what about those COVID lockdowns in 2020 and 2021? Where were those people that the health department's claims that they're protecting all these people, but our children were truly the shrapnel in that mess, and our kids are still struggling where they are. I had talked to a counselor that works with teens, and she said to me she'd never seen anything like it. I don't know how we are going to come from beyond there, but I do think the answer for me is that I want people that support my values, support my children, and really want to stay farther back and let me decide how I would like to raise my children.
but we also need to look at, I'm beyond elated to see that our families and our children like we're in strong support of Dr. Nevin. I see that this is a man who truly wants to do what's good for the people. And, choice for vaccine, I think is good. If those people want a vaccine and do 72 vaccines, then they should do that. But if I want to meet this requirement, I'm okay with that too. But I do think that it's our right to choose. And I'm tired of people saying that they want they want us to stay out of the exam room. Well, I have news for you. My kids don't go to an exam room without me ever. I do not think, and did we not remember what happened in January? When left to their own devices, crazy stuff happens. And these are my kids and those are your kids, and they matter. All of them matter. So I just wanted to tell you that I am in support of what we can do with Dr. Nevin's contract and making these amendments. I think that's good. And I'm also in support of him with the deputy. I mean, the man who runs the dump has a deputy. Tom Hall wants a deputy. We all need deputies because how are we going to support our contracts and our things that need to go on when he's not there? Thank you.
Sandra Richardson. Sandra Richardson, followed by Jim Frank.
Good evening, Commissioners. I want to thank all of you for your hard work, and I trust that the decision you make on this contract will be the right one because I believe you know the needs of our community. And I've been at many of your meetings. I've been to many of the Health Advisory Board meetings and many of the meetings in all of our townships. And it really bothers me when you think that a medical director that's given so much to our community is here for the wrong reasons. Because if any of you had attended the meetings that I've been to, there isn't a meeting that Dr. Nevin's been at that he won't stay and talk to our residents and explain what any of their questions or even to discuss their differences in opinion. So I've never seen Dr. Nevin hide from anything. I've never seen him take information in a misleading way. So I think you have a very intelligent man in our community and we should be proud of him. This whole indication that anything he did for solar was for attention is disgusting because we had young residents that lived in these problem areas that came with medical problems that was caused because this was brought into their communities in Shiawassee. So at no point in time was this taken lightly by our county, our commissioners, Dr. Nevin, Liz King, or the Health Department Advisory Board. So I would just like to again thank him for all the hard work he did on that. And I think if there's anything you disagree with him on, he's open for comment. He's open for discussion, Dr. Nevin is. I've gone to the health department. I've been there for immunizations. And Dr. Nevin has never discouraged anyone that I've been to the health department with or myself to not obtain the proper health care. So again, I think Liz King is doing a fabulous job over there. Dr. Nevin is. And for him to ask for a deputy clerk is just something that is needed. It's a sign of the times. It'd be like, and I'm not comparing it to sports. I'm not comparing it to any of the athletic people that have contracts. But what I will take it to a simple, if you talk to a president of a school, they all have probably 3 vice presidents or principals at their schools. Now that allows him time to get out in the community, which he does do, and educate and be there for the community any way he can. So again, and then on the fluoride issue, that again, like this doctor said this evening, it's definitely up for discussion of how much fluoride should we have in our water. So if that's up for discussion, we definitely should be looking at it. And I would reach out to any dental person in this community to offer more services at a reasonable way for these people that have no dental insurance and see what they can do for the community. Thank you.
Jim Frank, followed by Jill Bartow.
Good evening. I'm Jim Frank. I'm from Lakeport. One of the things that really strikes me as interesting is the politicization of this particular position, which was done by the board originally under the prior medical director that was here. And because of the actions that she took during the pandemic in regard to vaccines, social distancing, and other measures, this board chose to split her position into two, the health advisor, the health officer, and the medical director, in order to push her out. It was clear that was the motivation for doing so. Interestingly enough, additional research has shown the vaccines probably kept up to 58% of the people who were vaccinated out of the hospital. Social distancing works, masking works. All these things that were implemented work. And, you know, I appreciate you would save your comments for your time. Now, what we're talking about here is we're talking about creating a position that is one that cannot be scrutinized. Now, the case with Dr. Mercatan, she was not released because of cause. She was released because they split up the position. And so I see this action as a way of insulating who they want to name as the medical director from being voted out. Now, if you look at your bylaws, and I know one of my colleagues is going to talk about the bylaws here in a moment, I think you ought to reconsider that particular item. But when it comes to solar, the ordinance that was fabricated is made up of scientific measures that have no basis in actual science. The sound qualities that are there are not based in science. The visual aspect and visual pollution is not something that has ever been scientifically vetted. These are invented measures to prevent solar from being sited. Now, whether solar should be sited in those particular places and whether people who own property in those particular places should be allowed to invite solar in, that's another matter. But these measures that are in that ordinance are completely and totally fabricated and fabricated by Dr. Nevin. And so when it comes to a medical director, we want a medical director who practices evidence-based science. It should align with our values. Science does not necessarily align with our values. We may want something, but if science tells us that it's bad for us, well, maybe we should reconsider what we're doing. So even if he's making decisions that satisfy you and make you happy, that doesn't mean it's good science. That doesn't mean it's good evidence-based medicine. That means he's being political and pandering to you. So I encourage the board to reconsider the terms of this particular contract, particularly the unanimous one, and provide the public with a performance
Need to wrap it up.
review. All right, thank you.
Jill Bartow, followed by Vance Richardson.
I'm Jill Bartow, St. Clair County resident. Thank you for letting us speak tonight. I appreciate all your hard work. Not fun, doesn't look fun at all. I'll keep it short. I am here in support of Dr. Nevin, and I truly believe that he's trying to do what's right for the citizens of St. Clair County. But again, I appreciate all his hard work he did with the solar and with all the other areas that he's working on. So thank you very much.
Vance Richardson, followed by John Corey. Vance Richardson, followed by John Corey.
Vance Richardson, Fort Gratiot resident. Been to years of meetings here, years of meetings of the Health Advisory Board. I've spoke with Dr. Nevin many times personally, to the side, after meetings, before meetings. I find he's always available. I find he's always influential in what he speaks at. I've listened to him speak at these different meetings. And he's always based on the most highly educated person I know as far as doing research. He digs into the facts, he presents them as he sees them, and he also supports the county that he works for, as well as the advisory board. I find him a person that you can talk to, a person that loves to dig into conversations on these subjects, and he's in the best interest of you as individuals, as parents, and as a member of the county and advisory board. So I support Dr. Nevin entirely. I think he's open to any suggestions and any thoughts that you have. And I think he uses medical basis for his decisions and what he does. Thank you.
John Corey, followed by Lynn Picard. Schroeder?
Good evening. My name is John Corey. I'm a lifelong resident of the county. And I saw in the paper the other day, an announcement about this contract was going to be up, and the suggestion was the contract would only be able to be terminated without cause for unanimous decision of the board. And I thought, I urge you not to do that. I've been an attorney for over 40 years in the county, and I have never seen a contract that required a board, whether it be a board of directors of a company or especially a governmental entity, to be unanimous. You make decisions that are controversial sometimes. You don't always agree on things, but you have a procedure for coming to a decision. That is, you each cast votes, and the majority of the votes carries the day. Sometimes when there's very important decisions, you say not just a simple majority, it's 2/3, but you never do a unanimous decision. You would get nothing done if you had to have unanimous votes on everything, on anything controversial. I've never advised anybody to do that. I think it takes away from your authority, and it sets a horrible precedent. You do it for Dr. Nevin, you got to do it for other employees as well. It doesn't serve the county's interests. Whatever you think about Dr. Nevin one way or the other, that's nothing to do with it. It doesn't serve the county's interests. Dr. Nevin could ask for it. If I was representing him, I'd say, sure, why not? Why don't you ask for twice as much salary as you're getting right now also? He can ask for that, but it doesn't mean you should do it. I think it's against the county's best interest. You can say no, and then it's up to him whether to accept the contract without that in there. And if he doesn't, that's his problem. But if you require that you guys have to decide all together on everything, giving up your right as an individual board member to cast a vote, you all have to agree on everything. And I think it's bad for the county, bad for the residents. I would urge against it.
Lynn Picard Schroeder. Lynn Picard Schroeder. I don't know that I have the third name right. Pickard, Lynn Pickard Schroeder.
Pretty sure she's the one that left.
Okay. Rochelle Bonelli, followed by Eileen Tesh.
Good evening. Michelle Benelli, I live in St. Clair. When I speak tonight, think about, my years working as a supervisor for many staff. I always thought about the position and not the person. You think about the position and not the person. The proposed contract for the medical director contains the novel requirement of a unanimous vote of the Board of Commissioners to remove a person without cause. I do not see in the Board of Commissioners bylaws any time when a unanimous vote is required. Section 13.3 states a majority vote of those present is required, except when statute requires it. This requirement is counter to the bylaws. Is it legitimate without amending the bylaws? It is certainly a unicorn in the county administration HR policies, which create complexity rather than uniformity. Requiring unanimity is widely perceived as an inefficient and unreasonable way for a small number to block action and obstruct progress. Lawyers on the board, it is only used in extreme cases in the courts. It is utilized as a barrier to ensure justice is served. It is not used at the state or federal level except for a vote on a consent agenda where no one disagrees or when the vote doesn't affect the outcome. It is a way for one member or small majority to block the vote of the majority. Our county government should not be
should do the most good for the most people and represent the majority of the public, not the wishes of a few radical fringe elements who may wish now or in the future to obstruct change. I have issues with the reporting structure. It appears the board is micromanaging rather than providing policy and guidance. Are we creating a whole new bureaucracy outside the administration whereby certain employees can negotiate unique reporting structures? How would that work? It is also of note that he is the only to be in office 2 days of 1 week per month. And what happened to his concern for medical oversight? Maybe requirement of the office is more appropriate. If you, the Board of Commissioners, I ask you, the Board of Commissioners, what is the benefit to the public of these contract components? I ask the board, who benefits by this requirement of a unanimous vote? Why is it necessary? Who benefits by this reporting structure and micromanaging it? Is it the public? Is it our county government serving we the people, or a single employee or fringe interest? Is some requirement even legitimate according to the bylaws? We do not need this type of employee. This is where I'm going to be more specific. We do not need this type of employee who's the lightning rod for constant controversy. It takes up too much of the board's attention. We should let the administration handle HR matters and refocus and get back to the governing of the board. Board of Commissioners, who are you serving? Democracy demands transparency, accountability, and service for the good of the people. Thank you.
Eileen Tesh, followed by Kevin Watkins.
Thank you. Before I begin, I forget, I just got this news flash. FDA and CDC documents confirm that since the year 2000, top federal regulators knew vaccines did not work and were causing diseases and death on a mass scale. If anybody would like that article.
Please, everyone is entitled to their 3 minutes. Let's have some decorum, please.
Thank you. My name is Eileen Tesh, and I am running for State Senate District 12 down in the southern end of the county. And I have spoken to many people about what's going on with the health department and Dr. Nevin, and I'm here to support Dr. Nevin and the revisions of this contract. I've spent the last 10 years exposing the corruption of elected officials and unelected bureaucrats and their failures in this county. Needless to say, I haven't made a lot of friends, but remember, except for Lisa Beeden and Paul Zeller, all of you were elected and you ran as Republicans. So I am a Christian conservative constitutionalist, and that is pretty much what our platform is. So when they say, oh, the majority don't agree with Dr. Nevin or don't agree or that we're fringe, no, you are here to represent the people. And that is why I am running, so that I can serve the people and protect parental rights and children, especially what was going on here at the health clinic. Oh, it was an oversight and Liz King apologized, but it should never have happened. And still they say when a child sees pornography, they can never unsee it. And that's what they coined it as. And it was approved by the state of Michigan. So I'm here to talk about, when we the people start standing up and speaking out, you are here to represent us. And I am in District 7. And we remember what happened, Mr. Van der Bosch, with the 26-mile road development and why you were voting against the people. Because you own land over there. So I'm just saying that the data centers, what's going on around this state, and the people are beginning to speak up, and county commissioners and elected officials are getting recalled right and left because they are not representing and serving the people. Thank you.
Kevin Watkins, followed by Sage. I'm gonna get your last name wrong, but it's Kevin Watkins, followed by Sage. Okay, is Kevin here? Kevin's first and then. Okay. I'll try to get closer to the mic.
Commissioner Bean, you're so soft-spoken. Yes, good evening. Quickly, commissioners, legal counsel and the county administrators, who in the world will come up with, you need a unanimous vote? I know the legal counsel. Mr. Gary Fletcher's law firm is not just one of the best in the county or the state, but the country. There's no way they advise you or something like that. So I know I'm not worried about it. Now, the whole thing with deputy medical director, how many counties have that? And why would we do that? Why don't Dr. Nevin just do his job? Why don't we just make him full-time? See, like I mentioned, Mr. Fletcher's office, law firm, they don't need legal counsel from him. Why are we paying him to give counsel on solar and these other issues when he's supposed to be taking care of the medical needs, the health needs of the county? So I question that greatly. That's what he wants. Why he needs a deputy director to do his job so he can do a job. We're not the county residents, and I'm from Wells Township and the president of Point Young Branch in the ACP. We're not happy with this. We want him to do his job. I'm concerned about that. And I wonder who is going to, this deputy director is going to be a PA or physician assistant or physician associate, or can it be a nurse? I take a DNP, nurse practitioner, doctoral nurse practitioner over a PA. Trust me. So I wonder when the applications come out, if you pass that, can we apply for that? The solar issue. I feel bad for the people. I'm in a rural area. I understand that. But the bottom line is, just like AI, you can't stop advancement. It's coming. So be ready for it and try to make it work for you. So I'm concerned about all the money we're spending. I guess now we take it to the state Supreme Court. Are we going to go to the U.S. Supreme Court on this? We're not going to win it. Understand that we can't stop progression. And it's not a Democrat or Republican thing. It's a money thing. It's a thing that moves into the future. So I'm concerned about all the money's being spent that we're trying to fight this lawsuit. And you see, every time we go up, we lose, and we get to keep on losing. And I'm sure Mr. Fletcher's firm is not complaining, but the citizens should, because you're wasting our money. So I'm very disappointed in that. But the big thing that's sticking with me today that I can't get over is that you're actually going to, one thing allowing to, you basically have a no trade clause. You're actually going to agree, please don't. I wish I wear this shirt here of Dr. King where it says, time is always right to do what is right. And I know the board, Commissioner Andrew, this is on you. Regarding you in the swing vote, and you mentioned that. Please don't let this happen. Thank you.
Sage, followed by Kathleen Grant. I'm gonna get it wrong. Thank you, Grantham. Thank you.
Hello, I'd like to use my time today to address Dr. Nevin's controversial stance on Title X funding, which covers a lot of very important medical services that I know I will have to use in 3 years when I turn 20, and a lot of people in this room will use. Such as cervical cancer screenings, which women ages 21 to 65 should be getting every 3 to 5 years. And breast exams or mammograms, which women ages 40 plus should be getting every year. This is a massive age group that requires these tests frequently enough for it to be concerning to take away. According to the CDC, 60% of all invasive, meaning deep tissue, cervical cancer diagnosis are identified in women who have not been screened consistently. I am not yet 20. If you saw my name on the newspaper in the memorials, would you have a clear conscience knowing that it could have been prevented if it had been stopped early enough? And on the topic of contraceptives, condoms and birth control, which is a very controversial topic today in particular, I beg you to understand, everyone to understand, that the question you should be asking is not, is my child having sex? The question we should be asking is, if my child was having sex, would I want them to be doing it safely? Because no matter how close you and your child are, there will always, always, always be things that they won't tell you. Saying no to contraceptives is like saying no to seatbelts. Are you driving unsafely? Probably not. But would you rather be the kind of person that says, no, I'm not going to make my child wear a seatbelt because I know they're not driving recklessly. Or would you rather be the kind of person to say, you should always wear a seatbelt, even if you aren't driving like a crazy person, right? For my last topic, I'd like to touch on family planning. Family planning does not cover abortion. It does not cover the performing of any abortions, and it is very important that that clarification is there. The family planning services that are mentioned in Title X funding are fertility services, meaning advice on fertility, advice for women who have issues with conception, and helping with pregnancy tests and fertility diagnostics. Now, I know most people in this room would never tell a woman that has problems with infertility that she doesn't deserve to have a baby or doesn't deserve those diagnostics. These are the kind of things that Dr. Nevin wants to take away from women in our community. So I beg all of you to think of us when you think of the decisions that are in his interest. And for my last thing that I'd like to say with the time that I have left is that whether you agree with me or not, I love every single person in this room, and I deserve that you have the right to health care, even if you choose not to use it. Have a good day.
Kathleen Brantham, followed by Lori Olford.
Dr. Nevin is a controversial figure in our community. Whether people support him or oppose him is not the point. St. Clair County is bigger and more complex than any one individual. I urge you to think carefully about all of the voices you have heard regarding Dr. Nevin, not just the voices that agree with your position. Consider the people who live with the consequences of the decisions you make today. The contract before you grants extraordinary protections. We've already talked about the unanimous vote of the 7 county commissioners to terminate. Ask yourselves, why is a unanimous vote necessary? Why should one commissioner have the power to prevent the board from ending the contract if 6 of 7 commissioners conclude that the relationship is no longer serving the best interests of the county? This is not a standard level of accountability for a public employee. Another provision raises additional questions. Section 1C states that Dr. Nevin shall be responsible for assuring medical director coverage in the employee's absence, and the contract contemplates the use of a deputy medical director. At the same time, residents have heard discussions about reducing services and cutting positions within the health department. It is fair to ask whether the priorities reflected in this contract align with the priorities being communicated to the public. The contract also explicitly permits outside counseling work. Section 2D states that the county consents to Dr. Nevin's self-employment as a paid professional expert consultant in the fields of occupational medicine, public health, and general preventative medicine and epidemiology. What concerns me most, however, is not what the contract includes. It is what the contract leaves out. I see no clear requirement for disclosing of consulting clients. I see no recusal requirements for matters that may overlap with outside counseling work or consulting work. I see no enhanced conflict of interest provisions, despite the fact that the medical director plays an important role in shaping public health policy and advising the county on matters that can have significant public consequences. When a public official is explicitly authorized to maintain a private consulting practice in areas closely related to their public duties, the public deserves transparency. The public deserves assurances that public policy is being guided solely by the interests of the community and not influenced or perceived to be influenced by outside professional engagements. This is not about whether someone agrees or disagrees with Dr. Nevin. It is about governance, it is about accountability, and it is about public trust. So please, I urge you, at the very least, do not approve this contract as written. We need protections to make sure that our public interest is being looked out for. Thank you.
Lori Olford, followed by Bill Pickard.
Good evening. I'm Lori Olford. I am the president of the Port Huron Area School District Board of Education, and I'm not here tonight to represent them or represent us. I'm asking that you carefully reconsider the proposed employment contract. with Dr. Nevin. During his tenure, the responsibilities of this medical director have steadily diminished rather than expanded. Among the most concerning examples being the closure of several school-based teen health centers and efforts to discontinue Title X family planning. These decisions have resulted in fewer services being available to residents rather than strengthening the health department's ability to meet community needs. At the same time, Dr. Nevin is requesting that the county fund the deputy medical director position. This too requests careful scrutiny. Rather than delegating additional duties to another administrator, the expectation should be that Dr. Nevin fulfills the responsibilities of the position for which he was hired. St. Clair County has significant public health needs, as we all know. Approximately 15% of county residents live below the poverty level, and tens of thousands of residents rely on Medicaid for their health coverage. These individuals depend on a strong, proactive public health department to provide the preventative services and improve community health. Instead of expanding services or identifying new opportunities to serve uninsured and undeserved residents, there has been very little evidence of meaningful growth in programs designed to meet these needs under Dr. Nevin's tenure. In my opinion, his tenure has been characterized more by organizational conflict than by progress. Rather than resolving the longstanding issues with the community and the health department, in many cases, he has intensified them. Effective leaders require not only medical expertise, but also the ability to unite an organization, build partnerships, and move the department forward. I don't believe that Dr. Nevin has spent time trying to resolve issues, and I really feel that that needs to be considered. The closure of the teen health centers illustrate this concern. Fortunately, Port Huron Area School District was able to independently secure health services, but other school districts have not been as fortunate. The Board of Commissioners serve as a governing body responsible for ensuring that county leadership remains accountable to both the board and the residents of St. Clair County. And I respectfully ask that you carefully review the proposed contract and determine whether it truly reflects the accountability that taxpayers deserve. I urge you to reject the provision requiring a unanimous vote to terminate the medical director. And I also ask that you decline the request to create and fund a deputy director until there is clear evidence that the current
You need to wrap it up,
responsibilities
please.
cannot reasonably be fulfilled by the existing part-time
You need to
medical
wrap it up.
director. Thank
3
you.
minutes.
Bill Pickard. Bill Pickard, followed by Shelley O'Brien.
I just wanted to say, my name is Bill Pickard. Me and my family live on Beard Road, but I farm in Port Gratiot Township, Clyde Township, Birchville Township, Grant Township. I raise non-GMO soybeans, edible beans, corn, winter wheat. And I just am a fan in supporting Dr. Nevin because he stood up against the solar companies. And they're nasty scoundrels, I'm gonna tell you. They're nasty. And I don't want it to go through because if it does, it's gonna be 7,000 acres lost in my area. And it will be ugly and our food prices are gonna go through the roof. And our electricity doesn't even help here. It goes to Chicago. They're extremely noisy, they stink. And if you Google it, industrial solar panels, they're full of cadmium, they're full of battery acid and everything that will kill everything in sight. And I just say Dr. Nevin is an intelligent man. He's very highly educated. And let's just keep him in there because I don't want the solar panels anywhere in my area. It'll be worse than bad. You know, they're nasty. My mother's 87 years old. She still lives in the original farmhouse. And they snuck around. I told them no. And I told them, get the hell out of here. Well, they snuck around 2 more times trying to catch her alone because she's got dementia a little bit. And I was afraid they'd talk her into it and sign something. Then I'm screwed. There goes all my my living and my hired man's won't have a job. And it just, do your research on these solar panels and get out, protest it, make up billboards, do whatever you gotta do, you know. And that's all I wanted to say. Thank you for your time.
Shelley O'Brien, followed by Catherine Fotakis. Tragus.
Hi, Shelley O'Brien. I live in Yale, Michigan. I have the unique perspective of sitting on both sides. I am an elected official. I'm a city council person in Yale, and I am also an experienced professional public administrator. I currently serve the Township of Speaker as a deputy clerk, and I also hold a master's degree in public administration. So I am completely familiar with both sides and what has to be done here. The one thing I learned in studying the whole of American and global policy is that humane governance requires two things. It requires equal access, and when the opportunity arises, deference goes to the citizen. I don't see that in St. Clair County. As an adult, I moved back here 14 years ago to help my mom with the family business. And as an adult, it is extremely difficult to get good health care in St. Clair County. I ended up having to keep my health care down in Southfield because I tried visiting the doctors here and the process is so daunting and the providers are so unqualified that I didn't feel safe here. McLaren killed my mom. So the fact that this person who is in charge of the health department right now is cutting services, denying access to people, is extremely disturbing. And Steve, you and I represent the same people. They're not happy that they're being thrown under the bus. They weren't happy to lose access to that clinic. Now you're talking about taking away family planning services. Do you know how many of these girls are exposed to the disease that gives them cancer, cervical cancer, and we're going to stop that? As someone who approves contracts, I can tell you that if a public administrator asked me as a council person to approve that contract that said that we couldn't fire them unless we all agreed, I would say no. And I would say, don't you already have an incentive in there to not be fired for no reason? Doesn't he have a severance package? Like, isn't there already an incentive in there? It almost feels like you're doing this just so you can govern your own personal agenda. I don't do that in Yale. I actually advocated for people to be able to have chickens. I don't even like chickens. I look to what my constituents need and I make sure that I try to facilitate that. I will tell you one thing I am doing to counteract what is going on at the county level,
Wrap it up.
the state level, and is we are creating a committee to
Please
create
wrap it up. You got 3 minutes.
community service for people that are being cut off Medicaid, and I suggest the county do the same.
Catherine Tragus, followed by Maureen Weber.
Good evening. My name is Catherine Fotakis. I am a Republican precinct delegate for Fort Gratiot Precinct 3. And I thank you, commissioners, for giving me the opportunity to speak tonight. I am here speaking in support of Dr. Nevin. I have met Dr. Nevin in some meetings and have had a chance to talk with him. I have observed that he is a very hardworking man who is extremely passionate about medicine, science-based medicine. He has a proven track record for successfully leading the Department of Public Health. And I would like to see that continue. He, as I mentioned, practices and leads with science-based medicine. He has always been available to me whenever I've needed it to discuss and explain things. That being said, I am would like to speak regarding two matters. One is in regards to the availability or presence of federally funded health clinics and other health clinics. It is very complicated. I forgot to mention that I've had 24 years of health finance a career at the Detroit Medical Center and 10 years for United Health Group Community and State, which is basically Medicaid services. Those are very complex regulations, payment structures, affecting where clinics are and so forth. So many of the community don't really understand what's going on. And I would like to say I'm not at the end, but in the end, I would like to say that we have a pretty conservative community, and many people, I believe, are just furthering their liberal self agendas. I would like to be very grateful and applaud now turning to sex education surveys for children having to declare what sexual orientation they are. And the clinics. I, for one, am a parent who my oldest daughter is 16 years old, was told by a nurse practitioner to have birth control and gave it to her behind my back. It happens. It is a government constitution that gives parents the control and the requirement to
Please wrap it
educate
up.
children.
Please wrap it up. You got 3
Yes,
minutes.
so I'm very grateful that he temporarily closed and inspected
up,
those
please.
clinics. Thank you so much.
I
I
need your
appreciate
sweat.
it. Goodbye.
Maureen Weber, followed by Leah L.
Hello, my name is Maureen Weber. I live in Marysville, Michigan, and here's what I wrote. Hopefully it comes through right. We, the United States of America, are about to celebrate our 4th of July soon, which was a congregational convention that did not want a king. So they had created a elected democracy where you have the vote as a majority and not unanimous consent. Back to do no harm. Does that mean you should shut off all our fluoride? Someone mentioned to put in milk. I don't know about you, but I cannot buy milk with fluoride in it in this country. I don't know if you can I can't turn on a tap and add in the fluoride for just my home. I pay taxes for my elected and hired leaders to do no harm. I have friends who don't vaccinate. Hello to my crunch ladies. The idea of signing a 3-sentence paper is somehow too much is ridiculous. And they would agree with that even. But to close all outreach clinics to give no one the option of is causing harm, let alone Title 10. So back to why I was here. The idea you're going to change the way we can remove a director, just because you see the political winds against you and him is the opposite of what we fought for 250 years ago. Thank you.
Leah L. Leah L. followed by Diane Hewlett. Is Leah still here?
Hi, everyone. I'd like you to thank you for allowing me to speak today.
My name is Leah Lafferty. I'm 18 years old and I am a recent graduate of SC4 through the free Blue Water Middle College program. I graduated with an associate in science, concentration in biology, an associate in art, and an associate in general education. I am a first generation farmer. I have been farming for 8 years through St. Clair County 4-H. I've raised poultry, KVs, swine, steers, lambs, rabbits, and next semester I will be heading to MSU to pursue animal science. Thank you. Thank you. I will be heading there for free through a combination of scholarships and grants. I'm a graduate of Yale. I've returned actually this past season to be the head coach for their trap and skeet program. I am an example of taking resources as they come to me. I also live in poverty. I am the daughter of a single mother. I have accepted many a breakfast and lunch from the SC4 food pantry. I utilized the former Yale Health Clinic. I went there for free physicals, for professional first aid. I went there when I got the flu, guys. I think that we are forgetting people. We are neglecting the needs of our poor community. We are neglecting the needs of young people, especially. And I believe that Dr. Nevitt is forgetting his place as a servant to our community. The majority of you and many in attendance tonight have had the privilege of healthcare. I urge you to remember that the residents, that you are taking that from.
Diane Hewlett. Diane Hewlett, followed by Libby Prill.
Hi, I'm Diane Hewlett from Riley, and I have been to many of these meetings, both Health Department as well as Board of Commissioners. And I am in support of Dr. Nevin. Sorry, I just have random thoughts because I wasn't going to talk. But I am in favor of his renewed contract. And others are saying that others can make the decision for him, which to me seems like they are trivializing his license. But why hasn't anyone else stepped up and to the plate, earn his degree, and then come back to this board and talk? And as far as the deputy director, I don't feel that Dr. Nevin wastes resources. So if he says he needs one, I believe he does. And he does follow science regarding the fluoride. The EPA is working on recommending the same information as he is giving out. So he does follow science. As far as the parental choice, we don't know if those vaccines are safe. You say they are, but we don't know that. There's no list of ingredients. We have no idea what is in them. And I just ask, why do you trust them so much? I don't see anybody addressing all of the vaccine injuries, and there are so many. I've talked to a nurse herself that was in a wheelchair because of this now. So, and by the way, you guys were degraded by one of the attendees here, and I hold you in very high regard, all of you, because I am just blown away by all the subjects that you have and the topics that you have to be on top of. It's pretty amazing. Let's see. Oh, and by the way, lots of people carry guns. I'm not sure why that was pointed out, except to make him look bad. But with all the angry people around, particularly in this group, I can see why he certainly does carry one. And when I asked him how he handles all this criticism, he simply replies, "I've been to Afghanistan. This is nothing." Which, and so, and by the way, I do not put all this pressure on you. Miss Angie, because there were 7 of you making this decision, so I don't think that was fair to call you out. And,
All right, your time's up.
okay, happy 4th.
Libby Prill? Libby Prill?
Good evening. I'm not sure where to start. What I would encourage you to do, I'm going to ask a few questions. I hope that maybe you can take some of your commenting time. When you do your little roundtable, maybe you can address some of this. I've heard a lot of misinformation again tonight, and so it's very confusing. Sometimes I think that the biggest problem we have is reading comprehension, because what I'm reading does not line up with what some people are saying. I don't really have a problem with a contract. You don't need a majority vote if he is performing poorly, if he's insubordinate. I mean, you don't need a majority vote for that. This is only if, let's say you get a new board in, different political, opinions, and everything's getting politicized. So it just prevents a good employee who is performing competently from being fired without cause unless all of you are in agreement. That's how I read that, but you can clarify it. I don't have a problem with the deputy. Everybody else has got a deputy. We had a superintendent that got up and spoke. She has deputy superintendents or assistant superintendents, and you need them. Trust me, I retired from schools. I don't begrudge that. Nothing's changed with the vaccinations. Now the government is, Health and Human Services changed the schedule. But as far as waivers, nothing's changed since I worked as a school secretary many years ago. You've always been able to get a waiver. Michigan don't even have to have a reason. And the only thing that we've done, and correct me please if I'm wrong on this, we've just put it online. So some people, what they want to do, they think if they punish a parent, all the parents that you're worried about that, they can't drive to Port Huron for the clinic, so we have to have the outreach clinics, right? They don't have a car, they don't have gasoline. But you want to make that same parent, if they have a reason why their child can't be vaccinated, you want to make them jump through hoops and drive over to the health department for the same waiver that they can do online. Fluoride, again, I think this is going to be about community choice. If your community chooses to continue fluoridation, then you'll have fluoride in your water. If I'm wrong, please correct that. I think a lot of it is that some people don't believe in autonomy. They believe what they believe, and they want to force that on everyone else. I'm about choice. My body, my choice, unless my choice doesn't agree with your choice. And I think that's wrong. I think we need to leave it to the people in their communities to give as much autonomy as we can. And I hope that you will do that. And finally, regarding these teen clinics, as far as I know, Port Huron, the teen clinic is there. Algonac, the teen clinic is there. I know my time's almost up. So this is really about transitioning, not necessarily about closing. So thank you very much and happy 4th of July.
I have no other citizens wishing to be heard this evening, so we will move on to updates. Are there any updates from commissioners? Commissioner Smasko?
Just that we have 2 millages up. We have our veterans millage and our senior millage, or no, it's the ambulance millage and the senior millage is up this year. Just make note of that, it's something that people want to keep an eye on. The absentee ballots went out. They came last Tuesday, I think. So just wanted to mention that as far as an update. We support that, and those are on the ballot. That's it.
Any other updates from commissioners? Moving on to conceptual initiatives, there are none tonight, no old business. Moving on to new business, item 7A, the Blue Water Recovery Outreach Center opioid settlement funds proposal and agreement.
Make a motion to send to the full board.
Second. Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Motion carries. Item B, the medical director contract.
Motion send it to full board.
Support. Any discussion?
Yeah, can we just take a minute if you don't mind?
Discussion, yeah.
Yeah. But Todd, can you jump in here? Because I know that I had some questions in regards to the unanimous board vote for Dr. Nevin, and thank you, because I was reading it two ways, and I'm thankful that you clarified it for me. And so can we take a minute to also kind of tell them it's a little bit more of a safeguard for the county? Can you
Sure.
explain that?
Yeah,
Before you start too, Tad, just so you know, this Times Herald article came out and I got some calls on it right away. And the same issue is that there were things that people immediately jumped to conclusion on based upon the article that was at least maybe not intentionally misleading, but it caused people to make some bad assumptions. And so I think that's what you're talking about is.
Yeah, and this is just a good opportunity to have transparency and accountability. And so, yes, I did get a
Yeah.
lot of feedback on that, and so thank you for your time.
Sure, thank you. I'd be happy to explain how the contract works because you're correct. I mean, there have been a lot of misinformation out there, including on social media, and I think a lot of it was generated by a Times Herald Facebook post, which had a conclusion about this contract that was just flat out wrong. So if you look at this
What was
contract.
that conclusion, Ted? It was wrong. What was the?
Yeah, so I mean, the statement was the St. Clair County Commissioners will vote on a new contract for Dr. Remington Nevin that requires a unanimous firing vote. That's what it said, and that's not even close to being correct. So if you look at this contract, you look at 1C, it provides a 3-year contract. And then somebody said that it had an auto renew provision. No, it does not. It says the agreement shall terminate upon expiration unless renewed by the parties. So that would mean the county would have to agree to renew. And then it goes on to say the very next sentence says this contract remains terminable before expiration by mutual consent or otherwise for cause as provided in the County Commission Act, MCL 46.11, subparagraph N. So a officer who is appointed by the board has certain statutory rights, and those statutory rights include 2 ways in which this board can remove an officer. One is
Majority or full support?
yeah, I'll get to that. Yeah, that is on a majority vote of the board. It's not a unanimous vote, it's a majority vote. So the contract expressly provides that you still have the right under the statute, and the statute expressly gives you the right to remove him for 2 different reasons, basically for cause. One is if, in the board's opinion, the officer is incompetent to execute properly the duties of the office. So this board has the ability to remove him on a majority vote. And then you also have a whole procedure if there's any type of misconduct or a failure to execute or willful neglect of the officer's duties. So you have those rights already. Those are both majority votes. So what this contract then says, it says additionally, so this would be a 3rd reason the board would have the right to remove him beyond the statutory provisions. And it says additionally, the parties agree that this contract may be terminated without cause by the board by unanimous vote. Okay, so this was if you, all of you basically get together, he's agreeable to give up his statutory rights to only be terminated for cause. And he's agreeable to saying, hey, if all 7 of you want me out, I'm gone. Okay, that's what he's agreed to. So the contract doesn't say he can only be removed by a majority vote. It says there's 3 ways you can remove him during the term of his contract. And 2 of those are by majority vote. The other one is an added one where he's given up his statutory rights. So I think that answered your question.
Yeah, I hope so. And I hope that clarifies a lot for the public that is with us tonight too. Thank you, Lisa.
Is there any other discussion?
I've got a question for Todd, if I may.
Sure.
Todd, I've gotten a couple of questions from citizens regarding whether the contract complies with the public health code. I presume that you as our corporation counsel have gone over every line dot and tittle of the contract to ensure that it does comply. Is that accurate to say?
Yeah, so this contract, I think, another attorney at my office was involved in this, but I've had a chance to step in and review it. And so, yeah, I believe this, qualifies under the statute and meets the requirements. And what the contract's trying to do, as I see it, is, it's trying to comply with the regulations. So the regulations spell out what happens when you have a health officer who's not a physician and how you're supposed to handle your health department. So the regulations, specifically say a health officer shall be a medical health officer or an administrative health officer. If the health officer is not a physician, a medical director shall also be employed who is responsible to the health officer for medical decisions. And then it goes on to say a medical director shall be responsible for developing and carrying out medical policies, procedures, and standing orders, and for advising the administrative health officer on matters related to medical specialty judgments. And then it goes on to describe, okay, what happens to the role of the health officer? They are considered an administrative health officer, which means a person who is responsible for developing and implementing good administrative practices and policies for the local health department and its program. So what it creates is this situation where if you have a health officer who's not a doctor, then you have the doctor that making the medical decisions. That's basically the intent behind it. And if you look at the contract, it's consistent with that. There might be a couple tweaks I would recommend to it, because I think it probably should clarify a little bit better in a spot or two, but on a whole, I think it is targeted towards that intent, which is consistent with the regulations. Did I answer your question?
Thank you. Yes, you
Yeah.
did. And as far as those amendments that you would recommend, will you share those with administration prior to our next meeting on July 16th?
Yes, I will.
Thank you. I don't think I have any other questions for Mr. Shouty, but I've got a question for Tom. Just to clarify, to make sure that this whole situation is completely clear. Both the health officer's contract as well as Dr. Nevin's contract had an auto renew provision in it, right?
That is correct.
Both of those contracts did.
Correct.
Both of those contracts recently auto renewed. Is that right?
Health officer, Liz King was earlier this year. Dr. Nevin was June 23rd. So just recently.
Health officer was in March.
Are there, are these two the only two in the entire county that have auto renew provisions in their contract?
So when we drafted my contract, we removed the auto renew because that was something that we had heard from the board. So these are the only two contracts that currently have auto renewal in them, yes.
And that is at the behest of this board who, at least since I've been sitting here, has been talking about removing those auto renewals for these contracts universally.
Correct.
And the current proposed contract, amended contract for Dr. Nevin does in fact remove that auto renewal provision.
Correct.
And you're currently in the process of renegotiating the contract with the health officer as well, is that right?
Correct.
And so her auto renew provision will also no longer be a part of her contract going forward as well, provided these contracts are agreed to and adopted. Is that correct?
Correct.
Thanks, Tom. I don't have any other questions.
Commissioner Rushing?
Just three, and everything that in this contract, I believe there's three, very short, but three things. The medical decisions by the statute and what's required by the Michigan State Constitution is the medical director, whoever that sits in that seat, will be making the medical decisions because that's their specific duties. And the administration will be making the administration decisions. So the medical will be made by the medical director as pertained by the Michigan State Constitution. Correct me if I'm wrong. The second one, this unanimous, that gives extra protection for the county also. That did not have to be in there. This has been argued in court with what happened over in Ottawa County. Medical director was assisting or they worked together, we'll work with anybody to get these contracts. This did not have to be in there. He volunteered this, that if this board unanimously, we have two other avenues that we could remove them, but if this board unanimously, whoever's sitting in our seats, decide to get rid of the medical director, we can do it on a unanimous decision. And that person will, or he will, if this contract goes through. And again, I'll just reiterate on the auto renew. I'm glad that we do not have the auto renew because I think that's our responsibility each and every time that a contract comes up on these important positions that are held within the county. So I'm glad the auto renewal will be gone, and that also protects the county. Because what happened in the past is that the county commissioners, it wouldn't even be on our agenda. It would just be auto renewed. I mean, it got auto renewed. So that was also part of the discussion to add additional protection to the county to get rid of this to where at least when the contract is up, it'll be on our agenda, and then we get to decide whether it's going to be renewed or not. So that's all I have to say.
Any other commissioners? Commissioner Zeller?
You
We
did have
we
your
haven't, yeah,
hand.
we haven't, well, we haven't heard from Commissioner Zeller yet.
He had his hand up first. I
Mhm.
feel like I'm being rude, but, okay. So Todd, if you would, walk back through that highlighted component about the responsibility of the medical director, medical health director in their relationship to the public health officer. So health officer makes administrative decisions, medical director makes medical related decisions, but the medical director is responsible to the health officer. I heard that phrase. Walk me through that phrase again.
Yeah, so the regulations say that if the health officer is not a doctor, then a medical director shall be employed who is responsible to the health officer for medical decisions. And then they go on to say a medical director shall be responsible for developing and carrying out medical policies, procedures, and standing orders, and for advising the administrative health officer on matters relating to medical specialty judgments. And then it goes on to define what the role of the administrative health officer is, which your health officer is designated an administrative health officer if they're not a doctor. And it says which is defined in the regulations as a person who is responsible for developing and implementing good administrative practices and policies for a local health department and its programs. In other words, your health officer, if they're not a doctor, they basically are running the department, all the administrative stuff, all the payroll issues,
Yeah.
all the employee issues, et cetera.
Yeah, and so the health officer is responsible to defer to the medical director for medical judgment, but the medical director is responsible to the health officer. Again, that phrase. And so there's this circle established that both of them have to work in cooperation, which is in the new contract, which I like, that it's spelled out that they have to work in cooperation. So I'll just, throw the bomb on the table. What happens when they don't? So what is the process if the medical director has an opinion and the health officer doesn't like it under this new contract? What play it out and then play out the reverse?
Yeah, I think your contract spells it out. It basically goes to the administrator.
The conflict resolution provision in there.
Okay, so the public health code,
They both report to the administrator, the county administrator, then he makes a decision as to who's
Yep.
laying that decision.
yeah, so the public health code allows for this cooperative attitude. The contract allows for this cooperative attitude. And now the contract repositions the medical director to report to the administrator. Yeah, I think, right?
Yes.
Commissioner Smasko?
There's one other level on that too, Paul. This conflict resolution, if the medical director and the health officer can't collaborate and partner effectively, they would take it to their supervisor, which previously was Carrie Hepting, was the supervisor of both those positions. And so if Tom then would get involved with sorting out their differences and helping them collaborate and partner, and he could even then bring that to the board as the local governing entity under the public health code, because ultimately that's how elected representation is filtered down into the department
is because this board, the kind of the buck stops here. Not that we want to micromanage it, but that's how I see the contract, is it has provisions for clarifying the legal authority, as Todd Schaude has told us, has conflict resolution provisions, which I think are reasonable, and some people have spoken about that. And then ultimately, this board would still be involved with the oversight as the local governing entity. Todd, does that comply with?
Yeah,
After Thomas has the opportunity, right, to go through a coordination conversation with the health officer and the medical director, right? It just, I don't know, this setup seems muddy to me, and I'm trying to
Well,
clarify.
you had a department, you were with the juvenile department. If you have subordinates can't figure it out, you gotta, as supervisor, you would handle that, and that's
Yep.
what Tom's gonna do.
Yep, and I think that's appropriate. Sometimes it feels like in this department, we're reaching one layer too deep as a board. And so I think this new contract is a good step.
The other comment I'd mention is, Carrie, we had the email that came in, I won't mention from who, but we had the email that you had sent out that went to Todd, and then we talked today about that, and you were gonna talk about waiving the attorney-client privilege on it, make that available if people wanted it. Did you want to cover that? Because I was in agreement with that. This is the email, Todd, that came in from a person from Fort Gratiot in her district, and it had a lot of legal analysis, and you wrote an opinion kind of back on that. It did have a legal bent to it, and it's something, I don't know if you forgot about that, but you had mentioned that earlier today.
Thank you. Yes, that's exactly right. I received an email from a citizen who was concerned about the contract complying with the public health code, and they specifically laid out their exact concerns in a pretty long email. And so obviously I went through the email and immediately reached out to our corporation counsel, Todd Schaude, let him know about these questions, and I asked him specifically about each of those concerns presented by the citizen. He then immediately analyzed the whole thing, sent me back an email explaining how each of her concerns complies with the public health code. And because that communication is considered attorney-client privileged, I wanted to forward Mr. Schaude's response to the citizen and/or anybody else who would want to read through it. But I wanted to make sure that we followed the right procedure to do that. So I'm going to ask the board to waive the attorney-client privilege as to Mr. Schaude's response to that citizen email outlining the concerns about the public health code.
And I would second that motion, and that's an email dated, I got a print here. So we got a reference
Today.
to it.
It was today, yes.
Yeah, that's, is that Wednesday, July 1st?
July 2nd.
July 2nd, yeah. It's the July 2nd email.
We already
That's
have
right.
a motion on the floor.
You got to deal with the first motion.
Oh,
Well,
So
when
hold
there's a
your,
motion
hold your
pending.
thought on that. Are there any other questions?
I just
or
want to make
comments
two more
about the-
comments before we move on from that. The auto renew provision, I was here in this board in 2010 or 2011. We hired Dr. Mercanton. That was a provision we had in the contract back then. I'm not sure why we did that, but this board made it clear, the new board that now sits here made it clear that we didn't like that. We were not going to do those anymore. And so they've been removed from all of Tom's contract, these contracts. So that was nice clarification. And just the last piece on this, for you, Todd, when a person has a statutory right, like under Ottawa, Hamby versus Ottawa, the court opined that MCL 4611N, the county commission statute on removal of appointed positions, provides certain due process rights to the individual. And that those rights would not be you couldn't just designate them at will, they'd have to waive those rights. Is that correct?
Yeah, I mean, actually, the Hamby case was a case where a court entered an order saying that the county couldn't remove the public health officer, and the Court of Appeals said that's wrong. They have the right to do so under 4611 subparagraph N.
Subject to the due process provided by that statute.
Well, anyone with a just cause contract, you provide procedural due process.
So then a person, in order, to me, and this is how I viewed it, is that basically this was offered to both Dr. Nevin and I believe Liz King, that they could offer this as kind of a concession, that they would agree that if the full board decided they should go, they wouldn't require a for-cause termination. They would just take severance and go. That's a concession on their part, not a gift. That's kind of how I saw it. Is that?
Correct. Yeah, that's something over and above. They would be
Okay.
giving up their statutory right to only be discharged for the reasons specified in 4611N.
I have nothing further on that. Thank you.
Tom, how close are we to finalizing the health officer's contract?
So I've been continuing to have negotiations with her this week. She was out of the office last week, which kind of jammed up the timeline a little bit. It wasn't fair to throw out anything to the board without having consideration for the health officer. So I held on to that and reinitiated negotiations this week when she was back in the office. So I think we're pretty close. Obviously, from a timeline for the rest of July, I think it would probably have to go committee and then full board. I'm hoping to have something prepared to you for August committee.
Are the amendments to the health officer contract similar to what we're seeing in the medical officer's contract?
Absolutely. The goal is to get them to be very consistent with verbiage and language. And at least that's what's being presented. I will state that there is language in the health officer's contract currently that states that she's an at-will employee, which I don't think is correct. I think that's in a position that is just cause. So that at-will language I would like to remove that too, because it's not legally accurate.
Both of the contracts that auto-renewed had that language. Both Liz King's from March and Dr. Devon's from June, both had that language that's now
Correct.
being removed.
And-
We'd have to
and-
negotiate that, but that's in the process, and you're having good luck with that, or they're working with you, they're collaborating and partnering together, and you're.
I believe so. I believe negotiations are happening in good faith to try to get this accomplished.
And to just clarify my curiosity, both of these positions can't be at will. They're both protected through health code. Yes? Right?
Correct, yeah. I mean, there's a specific statute on officers appointed by the board, and I'm not aware of any others other than those two that would fall in that category, and they are entitled to the protections under 411 subparagraph N.
Well, just on that issue, we make a lot of board appointments, and I've got a question on that for another day, but I believe that all board appointments are subject to that. Health Advisory Board, Elections Commission, all that stuff, but that's for another day, but that may be the case.
I have one more question, and I think it's probably best for corporate counsel. A citizen made a comment that this contract conflicts with the rule of 7 or the unanimous 7 vote conflicts with our bylaws. I think she stated it was 13.3. Have you looked at the contract language up against our bylaws?
I have not reviewed your bylaws, but you do have the right under this contract by majority vote still to let them go. So, so this is a extra provision that if the 7 of you all say, hey, time to go, the person accepts that and leaves. So if you look at what you're really doing is it's kind of like a no confidence vote, and you're giving the person a chance to avoid, going through what could be an otherwise ugly public process. And they're willing to accept that and go. But no, I have not reviewed the specific bylaws as to that issue.
Is that something that you could look at and bring
Sure.
back to us? I'd appreciate
Yes.
that.
Yep.
So just to go on record, I'm really unsure about this unanimous 7. I worry about the structure and the precedent that it sets. I understand the termination for cause, just cause. I don't know why we would need that third layer of protection, and I think that it gives the appearance of one individual having sort of free reign. If one person on this board it just digs in their feet and says, no, I'm going to be loyal to the person, whoever they are and whatever position is. I'm really uncomfortable with that. Adding that in there, having that in there, I don't know why it's necessary. So
What if it's a 2/3 vote? Would that be better in your opinion, or?
yes. Any other comments from commissioners on this? We have a motion on the floor. If we could have a roll call vote.
Commissioner Angie?
What's the motion on the floor?
To move the contract forward.
Okay.
Move to full board.
As is or with amendments?
The way the motion is as is.
It can be amended later
but it's being moved forward to full board as presented. If Corporation Council suggests some changes before in 2 weeks, it's common, we can look at it and say we need to make some adjustment like it did with the animal control. We moved that along.
Is there some kind of a time crunch that we're on here that you're concerned about, Steve?
I'm not concerned about anything. I just, no.
So would it be appropriate to perhaps put off the vote on the amended contract until maybe committee meeting next month, so that then maybe the health officer's contract might be finished being negotiated? We could talk about working out these desired amendments, including those that Mr. Shouty addressed a moment ago, that he'd like to suggest. And then as well as perhaps talking about the medical director's contract, all three of those things, and the deputy director issue as well at committee meeting in August. Would that be
Probably
feasible?
table it, just move it, the person that made the motion, amend their motion to table it rather than move it forward. And we can talk about it more in 2 weeks. That's what, I'm fine with that.
So if we table it though, are we able to amend it?
Sure. Yeah. If you table it, it came up as a discussion item today. We're talking about it. Nothing fancy about that. We're talking now, if there's some changes, we can move it forward and then make some additions later if we want. Or we can table it and have further discussion. Both contracts have auto renewed. They're having discussions with our administrator, so everything's moving nicely in the right direction. And this other piece on the Manning table change that's on your agenda, maybe put that with it, because one of your concerns was you wanted to handle everything at once, the contracts and the Manning table and all that. It's all just procedural stuff. It's nothing, that's fine to table it, but the person that made the motion would have to either amend their motion to table it rather than move it forward. And then the person that seconded it would agree, and then we could do that. I have no problem with that.
I just want to make sure we weren't under any kind of a time crunch for any
Well,
kind of a
well,
reason.
one time thing, there's a clinician, a physician assistant that is leaving in a couple of weeks. So there'd be some staff shortage, but I do know that Dr. Nevin and the staff over there have met and talked about how to handle that contingency. So it's not like it's going to be anything disastrous. So yes, it should be addressed and in an orderly fashion, but we have time to do it correctly and take a little time to look at it,
Thank you. Yes.
So I've been assured that service will be provided. They have a contingency plan in place. If this Manning table change does not take effect to allow for the posting of the job for the physician assistant deputy director, that, delay of a couple of weeks isn't gonna be disastrous. They got a plan to cover that. So, but it does need to get handled, obviously, and we're in the process. And this is important, as you can see from everyone's interest. And we want to, I always say, I'm never in a hurry to make a mistake. Just take our time and figure it out. But right now, the procedural issue, and our parliamentarian can tell us, we have a motion on the table, we have a second, and the only way to resolve it is either to vote it down or to have it amended to table it, and then we could do it that way, withdraw the motion to forward, table it, and then talk about it again in 2 weeks. Whether for final action or not, that's up to you guys, but we could table it and then put it on for full board vote in August.
I'm of the opinion that it should all be tabled. It should all be presented at the same time, and that would give time for the contract amendments that appear to be necessary, or at least advised by
And
our
you'd have more
attorney.
public comment as well. People could come in and comment on the amendments, and in addition, in advance of a vote, say in the full board in August. That's appropriate. Okay with that, Todd? Is that?
Yeah, I mean.
Procedurally.
You need a motion to table it, right? And then a second.
Commissioner Rushing would have to change his motion.
Dave, would you want to amend your motion to table that?
I don't see any reason to change the motion. We have a motion and a second. If you want to table it the full board, we're not approving anything tonight. If there's a sentence or a paragraph that's going to be reviewed by corporate counsel and give us suggestions, we can say, okay, now we can table it very easily at the full board and push it to the next committee in August. But if we get all the answers between now and the full board meeting and everybody's happy, we all get to vote at that time, you can table it in 2 weeks. If you're not happy with it, or vote it down. But I don't see any reason not to have it go to the full board and have corporate counsel work on it, get answers to our county administrator and to all of us, to where then we can make our decision.
Okay, I'll call the vote.
Well, my suggestion, Dave, before you do that, my suggestion would be to table it now. We will,
No.
I will not.
Commissioner
I-
Samasco, I've called the vote. We have to take a vote now.
Commissioner Angie,
No.
Commissioner Trello,
This is to push it forward.
yes.
Yes.
Commissioner Samasco,
No.
Commissioner Zeller,
No.
Commissioner Rushing,
Yes?
Commissioner Vanden Bosch.
No.
Commissioner Beeden,
No.
motion fails.
Moving on to other human services matters tonight. Are there any other human services to be brought forward? Commissioner Samasco?
I would like to move to add the medical director contract to committee next month. Just have it added for discussion as a discussion item. That's the same as tabling. It'll just be back. We're going to table it essentially.
So you're asking for it to be on the August committee agenda?
Yes, to be put
Okay.
on the August committee. I'd like a vote on that, to put that on for discussion with any additions so we can keep it moving. So we
In
don't
the
get
meantime, we can work on amending it.
Work on amending it and do all that. I get a second from Carrie, it'd be great.
I don't think you need a motion for it because any commissioner can put,
Actually, you do because the
Okay.
motion failed.
okay, thank you.
Second.
All in favor?
Aye.
Any opposed? That motion carries.
Fixed that, didn't we?
Yeah.
Thank you.
There, before we move on too far, there was a motion that you had brought up that we were pending. Do you still want to bring that up before I lose track of that?
To waive attorney-client privilege.
Thank you. Yes, thank you for reminding me. Head was spinning after that for a bit. Yes, so I'd move to waive the attorney-client privilege on Mr. Shouty's email that he sent me earlier analyzing the public health code against the contract.
And I seconded that.
Any other discussion on that? All in favor?
Aye.
Any opposed? Motion carries.
Thank you.
Thank you. Any other human services matters this evening? Any information only? I'll take a.
Motion to receive and file.
Thank you.
Second.
All in favor?
Aye.
Aye.
Any opposed?
Oh, okay.
Item 11,
Motion to adjourn.
Second.
all in favor?
Aye.
Meeting adjourned.
So, I guess we're doing this. A little bit.
It had to be
But then
painful
it
for all
was
you guys to sit here and
certain-
watch all these people raise allegations.
Call the Judiciary Public Safety Committee to order. Roll call, please.
Commissioner Angie,
Present.
Commissioner Beeden,
Present.
Commissioner Torello,
Present.
Commissioner Samasco,
Present.
Commissioner Zeller,
Present.
Commissioner Rushing,
Here.
Commissioner Vandenbosch.
Here. Seeing no additions or deletions or changes, can I get approval of the
Make a
agenda?
motion to approve the agenda as presented.
Second.
Any questions? All in favor?
Aye.
Opposed? Carried. Citizens to be heard, I've got two. Michelle Brown.
Hi, good evening. I'm here to address the animal control director position that was posted. Let me get my glasses on. And a structural issue within the job description. I come with years of experience in animal fostering, leadership, and administrative roles. As I reviewed the qualifications for this position, one requirement stood out, the expectation that the director be willing and able to perform euthanasia. Humane euthanasia is sometimes necessary when an animal is suffering beyond treatment. That isn't the problem. The problem is that the director is expected to be the public face of animal welfare, educating residents, promoting responsible pet ownership, building partnerships, supporting adoptions, assisting law enforcement, managing shelter operations, and earning community trust, while also being responsible for euthanasia. These responsibilities pull in opposite directions. And it's not just the director, members of their team are also expected to perform population control euthanasia, which contributes to burnout and makes it harder to recruit and retain qualified staff, in my opinion. Our community needs a leader focused on prevention in this department, education, outreach, and reducing the conditions that lead to overcrowding. When we place the emotional and moral weight of population control euthanasia on the department's leadership and their team, we make the role harder to fill and harder to sustain. If we continue to struggle to attract long-term candidates, we should ask whether this requirement is a barrier that many qualified professionals simply cannot reconcile with the rest of the job. Population control euthanasia is a specialized medical procedure. If it's not already handled by a licensed veterinary professional, the board should consider partnering with and contracting that function to local veterinarians. Their training and licensing are centered on medical care, and shifting this responsibility would allow the director of this establishment to focus on leadership and operations. It would also broaden the pool of qualified applicants by removing a requirement that discourages capable, compassionate leaders. As taxpayers, we fund this position to protect animals, serve residents, and strengthen community trust. We should not create barriers that limit who can serve. I respectfully ask the board to reevaluate the euthanasia requirement and consider contracting population control euthanasia to licensed veterinarians, rather than keeping it as a responsibility of the director or members of their team. This change would create a more sustainable leadership role, improve
You need to wrap it up.
and
You got 3
retention,
minutes.
and reduce burnout. And ensure, okay,
You need to wrap it up, please.
I'm wrapping it up.
No, you got it.
I'm
Everybody gets 3
leaving.
minutes.
Thank you.
Carol Miller.
Good evening, everybody. Many of you may have noticed that in recent months I've been quieter than usual and have chosen to sit in the back of the meetings that I attend. Although I have been silent, I've been listening. I have listened to the yelling, the interruptions, the inappropriate language, and at times behavior that does not reflect the level of professionalism or respect that our community deserves. We all have the right to speak and express differing opinions. However, we should always extend the same courtesy to others by allowing them to be heard. Disagreement is a normal and healthy part of public discourse, but kindness, respect, and civility should never be optional. I have also listened to conversations outside this meeting room and became aware of statements made about myself through email correspondence. Through a Freedom of Information Act request, I obtained and reviews those communications. Some of the comments and accusations were disappointing, very inaccurate, and difficult to read. For the sake of clarity, I would like to address one specific misconception. I never sought employment with animal control, nor was I ever that my objective. My interest was in helping rebuild a strong volunteer program made up of compassionate community members and young people who wanted to make a positive difference. The vision was simple: support the animals, support the shelter, and engage the community through education, volunteerism, responsible animal welfare initiatives, and community partnerships. Those who know me understand that I welcome differing viewpoints and believe the best solutions come from listening to others. Throughout my career in volunteer service, I have tried to approach issues with respect, collaboration, and willingness to work toward positive outcomes. I understand that not everyone will agree with me, and that's perfectly acceptable. What I hope, however, is that opinions about any individual are formed from facts, firsthand interactions, and personal experiences rather than rumors, assumptions, or words of those who may hold personal grievances. A strong volunteer program benefits not only the shelter employees and animals, but the entire community. Volunteers can help reduce cost, expand educational opportunities, increase community engagement, build lasting and meaningful relationships, and provide participants with a sense of purpose and accomplishment. The development of a trap, neuter, return program and potential creation of a 501c3 organization dedicated to supporting all of our county animals were among the many ideas that I explored to further these goals. Before I conclude, I'd like to thank this board for their time, effort, and dedication each of you gives in service to our county. The decisions before you are often difficult and are made under a significant public scrutiny. I appreciate your willingness to consider the facts, keep an open mind, and carefully evaluate issues before making decisions. In an environment where opinions are often shaped by social media, incomplete information, and heightened emotions, that responsibility is not always easy. For that, I thank you.
Any updates from commissioners? Hearing none. No conceptual initiatives and no old business. New business, fiscal year 2027, Michigan Mental Health Court Grant Program application for final action.
I'll make that motion.
Support.
Any questions on it? You want a roll call on the final action?
It's up to you. It's just an application. It's not financial at this point.
All in favor?
Aye.
Opposed? Carried. Fiscal year 2027, Michigan Drug Court Grant Program application, also for final action.
So moved.
Second.
Any questions on this one? Hearing none, all in favor?
Aye.
Opposed? Carried. Clemens Authority Participation Agreement.
Motion send to full board.
Support.
Any questions on this one? Hearing none, all in favor?
Aye.
Opposed? Carried. Any other judiciary or public safety matters? Hearing none. Receive and file packets.
So moved.
Support.
All in favor?
Aye.
Opposed? Carried.
Motion to adjourn.
Support.
All in favor?
Aye.
Opposed? Carried.
At this time, I'd like to call the St. Clair County Board of Commissioners Environmental Public Works Committee meeting to order. Can we have a roll call, please?
Commissioner Angie,
Present.
Commissioner Beeden,
Present.
Commissioner Smasko, Commissioner Zeller,
Present.
Commissioner Rushing,
Here.
Commissioner Vanden Bosch.
Here.
Commissioner Trello.
Present. Any additions, deletions, changes to the agenda?
Make a motion to accept the agenda as presented.
Support.
Thank you. Any discussion? All in favor?
Aye.
Any opposed? Motion carries. I have no citizens wishing to be heard. Are there any updates this evening from anyone?
I will add an update today, Commissioner Torello. Just wanted to let everyone know I did send over that final incident report regarding the landfill fire. So that should have been in your emails. Please let me know if there's any questions. We did have the EPA and Tetra Tech do air monitoring during the incident to ensure that there was nothing being spread into the air through the fire, just to ensure safety of the community. So, but everything, there was no significant damages, no injuries to anyone, and they put it out pretty quickly. So I just want to thank the staff over at the landfill that kind of came in on a Saturday to put out a fire, and then obviously all of the fire departments participating in that to ensure that the landfill remains safe. So thank you.
I did talk to Matt too today, and they're going to have an after-action meeting with emergency management and some of the fire departments and make sure everything is, we're all working the same direction, and just go over everything that was done and see if there's better ways of doing it, and then move on forward from there.
Thank you, Tom. Thanks, Dave. Anybody else with updates? No, good. No conceptual initiatives, no old business. Moving to new business. Item 7A, Professional Services Agreement, Birchville Township Master Plan Update.
Move to send to full board.
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Item B, Sponsor Contract Agreement, FAA MDOT Aero Capital Improvement Projects.
Motion to move to full board.
Support.
Thank you. Any discussion? All in favor?
Aye.
Opposed? Motion carries. Item 7C, Consultant Agreement, Mead and Hunt Airport Crack Repair, Sealing and Paint Marking.
Make a motion, send to full board.
Support.
Thank you. Any discussion? All in favor?
Aye.
Opposed? Motion carries. Item 7D, Contract Agreement with Lois K Contractor for Airport Crack Repair, Sealing and Paint Marking.
Motion send full board.
Can I get some support?
Second.
Thank you. Any discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries. Item E, this is a lease agreement for 131 Ash, Lot 16, American Custom Holdings LLC.
Motion to send to full board.
Support.
Thank you. Any discussion? All in favor? Opposed? Motion carries. Item 8 is the April 26 activity report.
Motion to receive and file.
Get some support?
Support.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. No other environmental matters, no information. Can I get a motion to receive and file packets?
So moved.
Support.
Thank you. All in favor?
Aye.
Opposed? Motion carries. Motion to adjourn, please.
So moved.
Second.
All in favor?
Aye.
Meeting closed. Next.
At this time, I call to order the Community Economic Development Subcommittee. Can I have roll call?
Commissioner Angie,
Present.
Commissioner Beeden,
Present.
Commissioner Trello,
Present.
Commissioner Samasco, Commissioner Rushing,
Here.
Commissioner Vanden Bosch,
Here.
Commissioner Zeller.
Present. Are there any additions, deletions, or changes to the agenda?
Make motion to accept it as presented.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Motion carries. I have no citizens to be heard and no further items on the agenda. At this time, I'd entertain a motion to adjourn.
So
Motion to
moved.
adjourn.
Sorry. Second.
Any discussion? All in favor?
Aye.
Any opposed? Motion carries. I feel terrible. All right.
Calling to order the Ways and Means Committee. Could I get a roll call, please?
Commissioner Beeden,
Present.
Commissioner Trello,
Present.
Commissioner Samasco, Commissioner Zeller,
Present.
Commissioner Rushing,
Here.
Commissioner Vanden Bosch,
Here.
Commissioner Angie.
Present. Any additions, deletions, or changes to the agenda?
Did we want to move that manning table change over? Did we want to get that handled, Tom? I know there's some time sensitivity to that, but I know, Gary, you talked about that, so. I mean, I'd make the motion if people think we should do that.
Thank you, I do.
I would move, we move the manning table change to full committee rather than final action.
Can you repeat that?
What's that?
The manning table change, rather than make it for final action tonight, link it to the contracts up for consideration on committee in August.
So you want to remove it from tonight's agenda?
Well, remove tonight's agenda, but then place it on the agenda for committee with the contract for the medical director, the health officer.
Okay.
Do this all at once.
Do you need a second for that? Second. Oh, sorry. All in favor?
I got a question.
Yes.
Tom, if you could just give an explanation on the time frame of this, that's why it was for final action.
Sure.
And we're gonna potentially tie this in with the medical director's contract. So I don't have an issue with doing it, but it's also gonna be a timing change. The, one employee is retiring, so give an explanation.
Yeah, so Dr. Nevin expressed, that this needs to happen pretty quick just to ensure that there is adequate coverage within the nurse practitioners, within the department. The employee is planning to resign, has submitted notice for July 17th. There's currently a part-time nurse practitioner currently employed. So it does open up some concerns regarding coverage. And that's kind of where that's at. I mean, are you looking for anything else, Commissioner Rushing?
I just would add to that.
Sure.
My discussion, I had some discussion with Dr. Nevin about that, a couple weeks ago and again today about the timing part of it. And, I think there's some feeling on the board that we should get all these matters coordinated before we move forward on them. And in that regard, Dr. Nevin indicated to me that he's been working with the staff over there for a contingency plan to see that there'll be not a struggle, but they'll be addressing that. We need to do it as quickly as we can, but this puts all the pieces together so everyone's comfortable to vote on all of them at once. I agree with that. That's why I made the motion.
Any further discussion? All in favor?
Aye.
Aye. Opposed?
I oppose.
The motion
Still, yeah,
carries.
6-1.
Thanks, Dave. Okay, citizens to be heard. I have two citizens to be heard. Miss Patty Samar.
I do not doubt for 1 minute that the St. Clair County Health Department needs additional nurse practitioners and other staffing. That seems to be a problem because you have a medical director who's misogynistic. But I just wanted to voice my opinion to all of you regarding the deputy medical director position. Previously, Dr. Annette Mercatant, who is now Dr. Gilmer, held the dual role of both medical director and public health officer for 15 years, the last 2 of which were during a global pandemic. Dr. Gilmer did not go crying to the board of commissioners and ask for a budget adjustment so she could hire a deputy medical director. Additionally, under the previous administration, the health department was engaged in community outreach, particularly during the pandemic, and the department oversaw 3 teen health clinics. To be honest, it's difficult to understand why Dr. Gilmer did not ask for an additional set of hands to help wrangle our very vaccine hesitant community during a global pandemic. But now, poor little Remy Nevin, he needs someone to give him a hand, and I cannot for the life of me figure out why. To do what? So he can spend his 16 hours a week writing more so-called public health memorandums full of run-on sentences overloaded with 20-letter million-dollar words designed to prove to everyone that he is indeed the smartest man in the room, when really, sadly, he is just the smallest man in the room. My point is this. Over the past year, Remy has decimated our public health department. He has reduced services And if some of those Title X dollars weren't required to pay for this deputy position, he would have eliminated those services and that, along with them, as many as 5 staff positions. Between the almost $200,000 in state funding from the teen health centers and the $500,000 in Title X dollars, Remy has recommended declining almost $750,000 in tax dollars, returning to our community to provide needed health care to our citizens. $750,000. I don't like paying taxes, but we all have to pay them. And I'm really happy when they come back to our community, especially when they are going to health care for the neediest in our community. Do not reward this wackadoodle quack with a deputy who will most certainly be Carolyn Richards from the Advisory Board of Health, who also subscribes to his quackery brand of medicine. Instead, fire him. Fire Remy now.
Miss Libby Prill?
Good evening again. I'm just kind of tickled here because it looks like Carolyn gets to add to her lawsuit. So the reason why I'm speaking a second time is I wanted to talk about securing funds, which I figure falls under Ways and Means. So, you know, there's been a lot in the news about how President Trump plans to gut Title X. And as a supporter of Title X, I urge the board to back Dr. Nevin in his desire to structure a plan to mitigate the loss of those funds. Hopefully, we all agree that those funds are important. We do need access to birth control. Some of the neediest members of our community do not have the funding to provide it for themselves. Women's health is very important. So I urge you to support Dr. Nevin in that respect in searching for those funds. I would also urge you to place a priority on continuing the transition of our CAHIC clinics, the remaining 2, which would be Yale and KPAC, to a private partnership. We successfully did that in Algonac, and now Port Huron would, you know, like to take the credit for negotiating their own agreement, and that's great. I don't think it matters who negotiates it. We were successful in getting those programs to transition, so I applaud both Liz King and Dr. Nevin's work in that respect, and we just have to kind of clean up kind of the misinformation in the community, such as a taxpayer, I don't care how the cash flow is handled. Tom, you would understand that. If $750,000 can be funneled through the county to support those services, we can funnel $750,000 through schools or through other private agencies to provide those same services. I don't think we have to be territorial how those funds flow through. We do just have to pursue them. So we don't want further misinformation spread. I actually, I support the deputy. I would like to see someone who is legally authorized to change orders. In, you know, the case of an emergency where Dr. Nevin isn't present, everybody has a deputy or an administrative assistant. He has nothing. I don't even think he has a clerk. So I think that's a little ridiculous. And, you know, I don't know what the hours that you're negotiating in his contract. The last thing I want to talk about is the solar ordinance. I was appalled. I was appalled by watching the, just the disparaging things said out in the gallery today when solar was brought up. To say that it is not a public health issue, that there's no effects to that is absolutely scientifically incorrect, and it is that type of indifference that has split this community. That's why we need Dr. Nevin. Thank you.
Mr. Kevin Watkins.
Kevin Watkins, Wells Township, Mr. Rush's commissioner. You guys, I'm glad you're not paid $35 a meeting like I was years ago in the Memphis School Board. You guys work hard, and you know what you get, you need more. I just want to mention a few things. First, Ms. Patterson, are you on fire tonight? And I want to say, Commissioner Andrew, you know I'm not picking on you. I just know how to count my votes. I see where you're going and I see where the swing votes are, where they're not, and where direction, so I need nowhere to lean. And then I want to just mention this one thing. First, I'm glad, I love having the committee meetings because you can get up to speak more times than one. It's hard to get everything in 3 minutes. I want to just mention out to Mr. Zeller, I want to say, sir, you are finding your mojo. You're finding your own, regards, I can tell the discomfort when you first became a commissioner, but it takes time. And so I had to commend you for that. And you have did something very important that I'm going to commend you for. That you personally have led the slow Mr. Rushing, Commissioner Rushing down in this rush to judgment, this rush to vote. With your what nurses do, the why, the questions. You're asking questions, we appreciate it. And when you do that, you sit back, you allow the other commissioners to think and ask the questions. Sometimes we need to slow things down. So I appreciate what you're doing. Please continue on. You found your mojo, and I think you're going any further. So thank you.
Thank you. Okay, moving along, number 4, updates. Does anyone have any updates for Ways and Means? Hearing none, I don't believe there are any conceptual initiatives or old business. Number 7, new business, Midwest Strategies Contract Addendum Lobbying Services. Can I get a motion?
So moved.
Second.
Discussion?
I would just like to say I'm pleased with what we're getting out of the lobbying firm, having been, on this commission for several years. We've changed over the years, and I appreciate the communication from Midwest Strategies, and I'd like to see our relationship continue with them.
Oh, thank you for saying so. Commissioner Smith?
And I would build on that. I was here a long time and we've had other legislative consultants, and Midwest Strategies does a really good job. They provide us with a lot of information. When I became board chair, I asked them to copy everybody on it, because they used to go just the administrator and the board chair, and we'd find out there's information we could have used that didn't get out to everybody. So now everybody gets it, and you can all see it's very thorough, and I really appreciate it as well. I think it's money well spent.
Thank you. Anything further? Okay, all in favor of putting that through to the full meeting?
Aye.
Aye.
Opposed? Motion carries. Campaign Finance US LLC Subscription Agreement, County Clerk.
Make a motion to send that to full board.
Support.
Discussion? All in favor?
Aye.
Opposed? Motion carries.
Opposed,
Oh, sorry.
just one.
One opposed. Motion carries. Excess workers' compensation coverage, Midwest Employers Casualty.
Make motion, send it to full board.
Support.
Discussion? All in favor?
Aye.
Opposed? Motion carries. D was removed by amendment of the agenda under number 2. Is that right?
Correct.
Any other Ways and Means matters? Information only?
Make a motion to receive and file.
Support.
Discussion? All in favor?
Aye.
Opposed? Carried? Motion to adjourn?
So moved. Support.
Discussion? All in favor?
Aye.
Carried.
Oh.